Hello, John Reddick here. I want to talk to you today about scaling your practice from your current revenue level to a much higher revenue level. Now, there are a lot of doctors that I know that are stuck. We have them come to us all the time. They're stuck at 90, 100,000 a month. So that leads to, about $1.2 to $2 million a year. And they've been at that level for a very long time. And they don't seem to be able to get beyond that. And that's for a variety of reasons. It's because a lot of times people are always practice owners are always trying to work up to something. They'll set a goal and then try to work up to that goal. So let's say they're at $2 million a year and they like to get to $2.5 million a year. They set that goal and then they try to work up to it. Well, that's really kind of the wrong way to do it. You don't want to work up to something because that puts pressure on you, your staff, and your office. What you want to do is work back from something. Now then, and I don't mean working back from a small goal either. So if you're stuck, say at $2 million per year, you can go to $5 or $6 million a year. And you say, well, that would be impossible. How in the world could I do that? Well, you've got to think about your practice and production a whole lot different. If you're sitting around there just thinking about more cleanings, exams, and x-rays and crowns and a few bridges, you're not going to get there that way. You have to think a little bit different. So I described it to one doctor like this. And this doctor's office runs about $3.7 million per year. So I said to the doctor, I said, okay, doc, if you want to get to, say, $500,000 a month, and you may say, man, where I'm at, that'd be impossible. But I want to tell you, we recently took on a doctor that was doing about half of that, about $250 a month, and made some changes, got him to see things a little differently, and he had a record month hitting right at about $400,000. So it can be done. You just got to change your thinking a little bit. And stop trying to work up to something. We're always trying to work toward a goal rather than working from the goal. So in order to scale up higher, you need to set yourself an impossible goal. I mean, something that you would look at it and it would scare you to even think about trying to get to that number. So let's just say, you needed $500,000 in 1 month to be working toward or to get to the revenue level that you want. So you needed $500,000 that month. So let's say you need that amount of money, you go into your staff the next day. What are you going to tell them? Are you going to tell them, hey, we need to get $500,000 in the office this month, so we need to get all the cleanings, exams, and x-rays that we can get in the door. We need to get as many as we can. Well, if your cleaning, exam, and x-rays, $300 or $400, you would have to see over 1,000 people to get to that number. Well, number one, you can't see 1,000 people in a month like that. Number two, the stress it would put on your office and your staff would be astronomical till you would all be burnt out. But what if you went in to your staff and said, we need to get to $500,000 this month. That means we need between 7 and 10 full arch implant cases and maybe some single implants, but you would only need 7 to 10 cases to get to that $500,000. Now, which puts a lot of stress on your office. All of those people coming in for cleanings, exams, and x-rays, and bridges and crowns, even though that's the bread and butter of any practice, is the hygiene department, keeping those chairs filled with regular people coming back that pay salaries and staff, light bills, and things like that. But to make the $500,000, you just couldn't do it. The stress would be astronomical. I've talked to multiple dental consultants, and we've been consulting with dentists for well over 20 years, and the offices that are taking in the higher end cases, your cosmetics, veneers, multiple crowns, even certain levels of ortho that focus maybe on Invisalign or other types of ortho, they say doing that kind of dentistry puts less stress on them and their team, and helps to get them to where they want to go. I mean, I've got doctors that'll do 120, 130 cosmetic cases a year. And when you're talking about cosmetic cases that are average of $15,000 to $20,000, that's some pretty significant revenue coming into the practice just off of those 120 cases. So what if you refocused, instead of trying to think about all the stuff you can do and out of everything you do to try to get there, and then think about the one or two high value treatment options that you can offer to get you to that number. Because it takes a whole lot less new patients. If you're doing dental implants and cosmetic cases, you're doing those, it takes a lot less people to get to that goal, and it puts less stress on your office. So you've got to think about that differently. So if you went in with a goal of getting $500,000 in your office that month, and you were going to do 8 to 10 implant cases, full arch cases to get there. If you're doing a combination of full arch and single tooth, it may be 15 or 20 cases in order to get there. Then you're not going to be thinking about all the complexity of the office, all these other things that make it more complex to get there. You're going to be thinking about the strategies that move the needle faster and in your favor. So you got to think back from the 500,000, not think up to it, because you're going to get bogged down with a bunch of external stuff, and you're going to be tired and burn out trying to do a whole bunch of procedures to get you there. So what you've got to do is just think differently. I've got a $500,000 goal this month, or I've got a $5 million a year goal for this year. How do you work back from that? And it changes your decisions. When the goal is so big it looks impossible to you, it changes the way you make decisions. It changes the type of patient that you want to concentrate on. It changes how your staff is motivated. It changes the procedures of how you work with people in your office. You become more efficient. The complexity goes away. The distractions become less and less, because you'll see a much more clear path to get to the goal, rather than fighting your way to a number. You're working your way back from the number. I learned this principle a long time ago, really from an author. Dr. Wayne Dyer was a self-help kind of motivational author, and he said that when he would sit down to write a book, he would have a title and an idea in mind, and so he'd call the publisher, and they would mock up the cover of the book with the title and the subtitle, what it was about, and send him a copy of that mock-up with blank pages on the inside of the book. He would set the book in front of him, and he would say, okay, now I need to fill the pages. He was working back from the end result. And as a result of that, it stirred his creativity. It got him to think about each page and what was going to be on each page. The path to that end result of that book being filled with what he wanted to communicate became much clearer. It's also the same way in your dental practice. You see, I believe it was Steve Jobs who said, an innovation is eliminating 1,000 things that you don't need and that don't work. There's a lot of stuff that goes on in an office a lot of times that's not needed. Everybody's always looking for more tactics. You know, do we need better website, more landing pages, more ad spend, more Google ad spend, all of these different things that people focus on, and they're constantly trying to fight through, when actually if you'll set a goal of what you want, then you'll begin to think different. Because if you set a goal, let's just to say to have 10 dental implant patients, new patients in the office that month, you're not going to be thinking about crowns and bridges and cleanings and exams and how many of those you can do. You're going to be thinking about, where are those people at? What is the thing that's keeping them up at night? What is it that they think about all day long? Where do they gather at? Are they on Facebook? Are they on Instagram? What is the messaging that's going to get their attention. So you're going to be thinking about those things and eliminating the stuff that's just fluff and distraction, and focusing on the things that really matter for your practice. So I want to encourage you today, you can scale. If you're at 2 million, you can go to $5-6 million. If you're at 10 million, you can go to 15 or 20 million. You may say, well, I just never have thought we could do that, John. It just kind of blows my mind to think that could even be done. Well, the fact is it can be done. And you may just need the guidance to help you get there, and we can help you do that. So again, I'm John Reddick. I want to help you scale your practice, get it to be more meaningful so you can do the dentistry you like doing, you're more satisfied doing, rather than doing the dentistry you just have to do and you go home burnt out and bored. You can get past all of that and be excited about going into the office every day, changing people's lives and changing your life in the process. Thanks for watching. Be looking for more videos on this channel to help you think differently about growing your practice.